The first sign of the herniated disc on the lumbar spine is like a sciatica pain. The pain that have their own pattern radiated from lower back to the buttock and radiate down along the patient's calf and along the feet. The second sign normally is the numbness and tingling sensation, especially on the feet and also on the toe of the patient. Another sign is a weakness of the muscle along the patient's leg, maybe the extension of the knee, flexion of the ankle, or maybe the toes. And the latest sign, that is the most serious sign, is the difficulty with urination and defecation. To diagnose this herniation, firstly, we need to take the examination with the patient. Major sign is pain along the legs, so we need to evaluate the straight leg raising test, which is we raising the legs of the patient and they're gonna feel pain along their legs. Another thing is we need to test the muscle power to know if the patient have the weakness of the knee or the ankle or not. In some patients, we also need to evaluate the rectal examination to see is there any weakness of the sphincter tone muscle that control the bowel and bladder symptom. After the whole examination, maybe we need another investigation, which is MRI scan on the lumbar spine to see is there any herniation in the pictures. In some patients, maybe they need another additional test, just like EMG or nerve study test, to evaluate the nerve function and the nerve compression symptom. Also, in complexity case, maybe the doctor required to do the procedure that called selective nerve root block. There is two benefits of the procedure. First is to give us the correct diagnosis. Another benefit is this is a treatment also, because when we inject two kinds of medication, which is anesthesia combined with steroid injection. So the patient gonna feel less pain and we can decrease any inflammation on the nerve and on the disc that herniated. If we talk about the risk factor of the disc herniation, there's few risk factors that is very important. The first one is the age and the activities of the patient. The patient in midlife age, just like 20 to 40 years old, this is very prone to have the disc herniation. The second risk factor is their body weight, which is very important factors. Think about if you have a lot of body weight, so the weight is gonna lower down to the two lowest part and they have more chance to have disc herniation. The third risk factor we call the genetic factors. The patient who have the familial history of the disc herniation, there is a higher chance if we compare to another patient, they're gonna have disc herniation. For minimally invasive spine surgery, we have two choices of the treatment. The first one is microscopic assist surgery. The microscopic is we use a microscope and do the instrument from the outside of the part of the patient. The second one is the endoscopic surgery. In this procedure, we put the endoscope, which is a small instrument inside the patient's body, and do the surgery from the inside. There's a lot of benefits if we talk about the minimally invasive spine surgery. The first one is smaller incision. Second one, less pain. The third one, less bleeding. The fourth one is less complication if we compare to the open spine surgery. And the fifth one is patient gonna have faster recovery, shorter hospital stay, and quick return to their normal life.